We're blessed to be with Dr. Giovannie Jean-Louis. You are a neuro-disability physiotherapist, the founder of PROBr, which is a cutting-edge medical research platform reducing research delays by connecting vulnerable patients with researchers, basically.
Yeah.
Just to get started, I'm super curious, like, what drove you to get into this work?
Yeah. So a lot of it, I give thanks to my clinical work. And sorry, can you hear me?
Yeah, we hear you great.
So a lot of that has to do with my clinical work. So working as a neuro-disability physiotherapist, I had the opportunity to work with children with cerebral palsy mainly. That was mostly my demographic. And we had people like parents who asked, are there like research studies out there that we can get our kids into? And funny enough, when I Googled that, I couldn't find anything that pertained to their demographic. And when I was a student and I was doing my dissertation, I wanted to do a primary study in multiple sclerosis, and I couldn't even do that. It was difficult. And so kind of getting that feedback from colleagues and from my personal experience drove me to this innovation.
I'm really passionate, and for those joining that are from Dr. Jean-Louis's audience, my background is I'm a nurse practitioner. I was focused in primary care, and then my research and work went into the microbiome of preterm babies and basically how we can give the next generation the healthiest start in life for free by promoting breastfeeding and making tools to make breastfeeding longer easier. So I think from both of our interdisciplinary fields, we have a really similar mission, which is to make better resources for the underserved.
Exactly.
And I'm curious because there's some stats here. 86.3% of researchers find it difficult to recruit patients, and 85% of clinical trials have delayed because of this problem. Can you relay maybe to our audience like why that matters to them?
Yeah. So the reason why delays in research matters is because a delay in research means a delay in the development of treatments, interventions, innovations. And not having enough people joining these studies means that it's less validity involved in it. So having a demographic, let's say, of people who are in a study, and then you're not able to validate that so that the greater population can use it and find a similar result, that can be an issue.
Yes.
So yeah, that's the reason why we're kind of putting that stat out there, because it is large and it does play a role into why there's not many treatments and solutions out there.
Yeah, let's talk a little bit about women specifically, and even further, like women of color, or moms actually that are in gestation. So it wasn't until 1993 that the NIH even allowed women who are pregnant to become a part of clinical trials.
Yeah.
And what that means is that if let's say there's a really low risk therapeutic, right? You just want to study how it works. So for instance, I was working on a study that was studying frequency of toothbrushing when I was in my dissertation. But until we have that data that shows, yeah, this actually does decrease the pneumonia that patients are getting because no one's brushing their teeth, period. We have to create a protocol around it.
Yeah.
And electively, you know, if pregnant women or women who are in their pre-gestational period want to participate in a study that is relatively low risk, you know, they've been informed of any of the risk, we're basically 30 years brand new in terms of like how any intervention or therapeutic could affect that really complex physiology. And I'm curious if you would describe PROBr a little bit as a tool and how it's helping mitigate that research gap so that we make safe and effective treatments and tools for women.
Of course. So the whole point of PROBr is to ensure that we have that collaboration, and that's something that we're missing. And so with the platform, we try to give empowerment to the patients and the clinicians so that
Yeah.
they're able to, one, the researchers, sorry, not clinicians, researchers are able to find those participants and also put out like different types of studies that they've been wanting to do.
Yes.
Researchers are very creative, and they may think of something and want to disprove or prove it depending on the hypothesis. And when it comes to participants or patients, they may want to be a part of something, whether it's because of monetary value or because they have a passion for it and there's a reason that they want to join it. And
Yes.
so our platform brings that together. We bring that collaborativeness into it to ensure that everyone's able to kind of achieve whatever goal they have that's related to research.
Yeah, and I like to think of it. Okay, so for those joining who maybe were like, wow, I really wish that I had, maybe they've tried breath work, right? That's a very simple intervention. And I wish I had access to that for free because it has demonstrated, maybe in like postpartum period where you're feeling exceptionally depressed or down, it has demonstrated benefit, right? But in order to prove anything about it being a reliable intervention, you would want there to be some sort of really repeatable study.
Exactly.
And researchers spend a lot of their time applying for government grants. And then once they have this resource, if they get it, so much time and energy trying to find the correct population to make sure that this really demonstrates effectiveness or not. Like, we're going to get to the no faster, right? If it doesn't. And the tool for that is like really seamless recruitment and retention, and how you actually provide value as well to the participant or find value aligned participants is so
Yeah.
key. Because otherwise, you basically are taking taxpayer dollars, funneling them into these little siloed studies, and then how many fail because of recruitment and retention issues?
There's a great percentage, but it varies
Yeah.
because where we're looking at is a greater aspect of things. So research studies, including clinical trials, observational studies, experimental studies, etc. But the percentage is much higher than what I guess we. Sorry, can you hear me? Yeah.
Yeah, there's a little lag.
And also retention rate as well, like you mentioned.
Mhm.
So you're able to recruit those participants, but then you have the dropout rate, and that plays a role into the success of the study.
And let's talk a little bit about, for our audience, why faster research and getting to a relevant result. Like, does this work? Does it not work for the people that you want to test it in? Matters for moms and babies.
Definitely. I mean, for anyone, but yeah, for moms and babies especially, that helps to get us to a quicker result. Whether it's a good or a bad result, at least we know, okay, if it's not good or if it's not the result that we wanted or thought it would be, we can move on
Yes.
to something that can resolve it a lot quicker, or we can find another alternative. Or in a good case, if it is something that's good, then we can kind of set it out to the public immediately, or as soon as we can get it approved, obviously.
Yes.
Yeah.
Yeah, and if you don't mind, I'll give a case study really quickly. So after doing research on the microbiome, actually the natural nipple was developed to become an easier way of feeding your baby when you have to be away and still getting that latch back to breast. So you can continue making milk with 83% less latching time, frustration, fussiness. The reason this is really important is because this is the first free food and life vaccine, but we saw that 92% of moms were really struggling to continue to provide breast milk, especially after going back to work. And so that left me with a really big question, right? Like, what's going on at that time point that's causing this hiccup in their feeding journey, and how can we make it easier? And after you listen to the market, which is, just qualitative research, like hearing over and over and again them explain, oh yeah, the shape, the feel, the flow of this bottle, it really doesn't match my mammalian evolution of a
Mhm.
breast. And I struggle continuing to breastfeed. So I give that example because then I was like, okay, what is the data behind this and what's actually the mechanics of what's going on? And we designed a study with the grant we received from the US government, the National Science Foundation, and actually very carefully looked at almost 300 babies that were born out of a hospital in California, and only looked at issues that could have been caused by introducing a bottle. So like they weren't being fed with an NG tube, they weren't being fed with a breast, they were being introduced a bottle, and flow is really the only thing that could have caused these feeding related events.
Mm-hmm.
And what we learned is that actually 1 in 4 babies were suffering from what we like basically choking. So they were having a hypoxia, bradycardia, and
Mm-hmm.
what that means is if you're a preterm infant and you're trying to intake nutrition and it's coming too quickly, you can't swallow,
Mm-hmm.
and it needs to be developmentally appropriate for what that baby can tolerate. And moreover, clinicians didn't have really clear data about how fast milk is flowing from these competitor bottles.
Yeah.
So that was what we call like a non-inferiority study, because we looked at what's out there, what complications, if any, are being
Mm-hmm.
caused to infants and to also the hospital budget. Because we care about babies not choking and dying, but also there's a cost that the hospital has from these double length of stay and consults of these vulnerable infants. And that's really important information, right? Unless this was organized and we could actually get a clear picture of like the flaws in infant feeding and the standards, how would we create a better infant feeding system? And that's prospectively what we're going to study with the natural nipple, is really how much does it reduce by controlling that flow and making it much more like natural transfer from breast to baby,
Mm-hmm.
these feeding complications, and help the hospital budget. So I gave that just as a clear example of like
Yeah.
200 years we've been making bottles.
Um, yeah, so you brought up a good point when you mentioned the clinicians not having the proper data to know the amount of flow for for the baby.
Yes.
That's one of those things with research, how that's important, because a lot of the time people let like the limitation of the data that they have
Yes.
be able to do different interventions. So I know myself, when I was a student, I would always be like, what does the data say? What does the data say?
Yes.
And usually if it's not a published paper, I'm not going to look at it. But then
Yes.
more autonomous, I do experiment with different like treatments with my patients, whether it's like helping with them walking, things like that. But before, I would always be hyper focused on the data. And I think there's a lot of clinicians out there who focus on the data. They rely on it in order
Yes.
to do with patients. And so having research studies that's like maybe 20 years and no one's touched it or updated it with like new data or new anything that can play a role into patient outcomes.
Absolutely. And you bring up a really valid point, is like not only was 20 years ago, maybe maybe like the set and setting also needs to be updated. Like, is this even an adoptable intervention and like, a modern clinical practice? And I think that's where personally I got a little bit of backlash, but I was like, no, I want to be the clinician and the researcher, because it's useless if you develop all this data but haven't consulted with the framework to implement it. And is this actually going to work for clinicians and for patients? Are they incentivized enough, to try this walking protocol?
Yeah.
So I think that is really where PROBr is accelerating um, effective tools for healing and health. Um, going down, going down more the topic of our audience of moms and babies.
Mm-hmm.
I think we mentioned the disparity of pregnant women like not being allowed to participate in research till 1993, but let's talk about why more Black women are dying than
Yeah.
other any other race, and how more research can help.
Yeah. Just to give a little bit of a statistic. So with Black women, the rates for death is much higher than white women, obviously. And so the statistic, sorry about that, it basically shows that there is 69.9 there's dying per compared to white women, which is about 20. Were you able to hear that? Sorry, I think it cut off.
69.9
deaths per
deaths.
100,000 live births for Black mothers in the US. And so that's 2.6 times higher than white women,
Yeah.
which is 26.6 per 100 live births. And so, like, from what the data shows, a lot of that cause is from systemic racism in the healthcare, higher rates of underlying health conditions and socioeconomic factors. So another thing that I've gathered, and this is more like in a layman's way to put it, is whenever a Black mother says, "Oh, something's hurting me," or "Can you look at this a little bit longer?" It's kind of like brushed off.
Yes.
In a way. It's overlooked,
Yeah.
especially from who may think, "Oh, she's like exaggerating," but really, I mean, they know their body more than anyone else because they're living in it. So
Yeah.
a lot of that again plays a role into the systemic racism. And also back over 30 years ago, when they had illustrations and pictures of babies and mothers and just Black people, they're not included in the history books and the health books where you're able to identify something. Because if I get a rash, I'm most likely it's going to look brown. I'm still
Yeah.
still going to look like my skin color, versus when you get a rash, you'll be able to notice it right away. And so we're not able to identify these key
Yeah.
subtleties that play a difference into life and death.
Yes. And it's astounding because when you think of like the systemic racism and unfortunately we as humans are gonna sorry um so I remember being on a plane
Mm-hmm.
and there was a Black woman that was about 6 months pregnant and she goes unconscious. Like she still has ABD, like airway breathing. ABCs are good, like airway breathing circulation. But eventually, like she was going into a hypoglycemic episode, and when we were able to bring her glucose up, she was sharing that she was just admitted to the hospital like 48 hours before, and I think that I think that for a long time, you know, like underprivileged communities like really got a lot less priority like in the ER and a lot less moments of education, which
Mm-hmm.
I'm curious about your thoughts around how we shift that, because on the provider side, you know, the system is so fractured. Like we have less than 15 minutes to see a patient, period.
Yeah.
And so I really think it's going to rely, I want to bring this full circle to the work that PROBr is doing.
Yeah.
It's going to rely on more innovative ways and more resilient ways of disseminating data in a way
Mm-hmm.
that patients can adopt it and advocate for themselves. Because what I felt, I was like, oh my God, like you you were just in the ER, like they didn't tell you that your blood sugar is not stable, like you need to monitor your intake of fluids and definitely not be on an airplane. you know
Yeah.
um, what are your thoughts with current tools to catch up and combat some of that unfortunate, whether it be bias and inherent racism or whether it genuinely be just lack of time that healthcare providers have?
Yeah. I mean, there's so many things. I mean, even the statistic for how many white doctors there are compared to Black doctors,
Yeah.
that tells you like the lack of advocacy that we have to help with healthcare.
Mm-hmm.
But to answer your question about how we can shift that, well, financial wise, obviously that would be very expensive because that would mean putting a lot of funds into these underserved communities
Mm-hmm.
and being able to have someone who's like a project manager, project anything who can actually hone in and use that money for what it's meant to be used for.
Yeah.
But a way that we can try to control things and shift that is by education.
Mm-hmm.
And so giving the patients education, because knowledge is power. And once they have that knowledge, they're able to advocate for themselves. I think
Absolutely.
at the moment we have ourselves who are advocating for these patients who don't have a voice or who don't even know that they have a voice. So there's some people who don't know that they have a voice and they can use it. And so what PROBr does is obviously we give those patients these empowerments to join these studies. They're
Mm-hmm.
able to understand what these studies are about. And once they get more involved, because when you're involved in something, you're most likely going to ask questions. You're most likely going to be awake and you'll remember a lot more things because it's interactive.
Yes.
Being involved in these types of studies that is related to whatever they're passionate about can help to kickstart that and also improve more of that thirst for education.
What you're doing,
Yeah.
and just coming back to what's driving you and what's driving the natural nipple. It's like, personally, I just feel, we all have a body. That's one thing we all have in common, is we're born in this world, and so few people have access to the education of how to heal it or make it last longer, or how it works. And you need your body to work to contribute to society in the way that you feel brings you joy and passion in life. And so I really love your approach, and I think arriving on a very similar conclusion, with the natural nipple, even though the product itself is designed after real mom's breast, shape, feel, and flow, to eliminate that number one barrier to breastfeeding with current bottles and make it easy to switch back to breast. I so believe in the power of access to education.
Yeah.
So you know, with every sale, like, we actually offer like telehealth coaching in your house. Like, if you need help figuring out how to get a latch, there's an AI nurse, so you're not relying on Dr. Google. That I'm like super proud of our clinical team for programming, because otherwise, if you're in the middle of the night and you have a brand new baby, you're like, you know, is this actually like my milk won't come in, or I have uncontrolled blood sugar that I actually need to get addressed, right? So putting the power in the patient's hands to really navigate their body and get the support that they need, in addition to the products that makes it easier to feed your baby and still be the best mom and the best professional. Because I feel that, getting support, like, when you're struggling to keep a roof over your head, you're just
Yeah.
oftentimes, it's like, how can we reverence again this period of life? That's what
Exactly.
that's what makes Nepal so successful at improving breastfeeding rates
Hmm.
from to 6 months and 2 years, is culturally, like, this wisdom is still revered of this ability to create life, and the community banding around you to support you and to nourish you, really, those first 3 months. And I'm like, how do we do that in a modern society where everyone's on their phone but give access to the resources? So I'm really curious what kind of studies you're doing right now, that are relevant for moms.
Yeah. I guess the studies that I'm doing that's relevant. Do you mean on the platform?
On PROBr, yes.
Yeah. So we have one condition. So we're adding conditions as we grow our platform.
Mhm.
But one of the conditions that is relevant is endometriosis. That's one thing that's common, prevalent in Black women,
Yes.
but um, it's one of those things where a lot of women deal with, especially if they want to become a mom.
Yes.
Um, we are hoping to expand on these conditions that can help with that, so that obviously it brings more awareness and more people are able to find quicker treatments with it.
And how would that work? Let's say I'm a mom, or I'm expecting, and I want to understand my body a little better. How do I see
Yeah,
if I qualify and partake?
yeah. So with the platform, you would sign up as a participant, and then you'll have like a list view or like a gallery view of different studies that maybe you qualify for. There may be, let's say there's a study for a mom who postpartum,
Hmm.
or a mom about to give birth, or someone who has preeclampsia, whatever it may be, and they'll have details of what the study will entail, how long it'll take, and if you fit the description of that, then you would just show interest, and yeah, you'll just wait for the researcher to get back to you and ask you more questions, and then yeah, you'd be enrolled in the study.
That's awesome. So it's PROBR.com is where they can find
.co, so co
.co.
co,
Perfect.
yeah, .co.
And then in terms of effective interventions, so for instance, I'll just give a case study of, we got this really robust data with a statistically significant about how competitor bottles are impacting the ability for a baby to swallow. And then we're like, okay, great. We know what to do about this now. We know controlling the flow and knowing the flow is the solution. And fortunately, with the US government, we were able to develop this post-production technology with the bottle that had never been reinvented since 200 years ago. So we're guaranteeing that you're hitting this target flow based on lactation for as the baby grows to meet their developmentally appropriate feeding needs. And we love the hospital that we partnered with in the beginning, and they're so keen to like improve the health outcomes of their patients, but there's so few babies being born.
Yeah.
So even we had to go really far back in time, right? Like the last 3 years to get this sample that is meaningful and tells us anything. And so now for the phase 2 study, we have the same protocol. We're just literally plugging in the natural nipple and seeing like, okay, how does this differ? What would you recommend for researchers who are going through similar challenges?
Um, I would say if a researcher is going through the challenge of trying to find, and is your question finding like the best hypothesis to start a study,
Well,
or
we have the hypothesis. We're just looking at feeding related incidents in bottle fed babies and long term health outcomes, but it's the recruitment
yeah.
aspect. Yeah.
So I guess for right now, it would be kind of looking within your local areas and trying to find those moms who you're trying to hone in on. But obviously, with a platform like PROBr, you would go on there and recruit the participants. So the way you would do it is obviously setting your proposal and then filtering out what participants would qualify for that.
Yes.
Um, so that's how it would work on the platform, and also making that proposal live. So then participants can see it and they're able to kind of feel empowered and have the autonomy to decide, okay, I want to join this because this looks like something that I feel like I can do.
Yes.
That's where it would go in terms of patient recruitment.
Amazing. Well, it sounds like just an incredible platform to really accelerate and
Yeah.
transform health related innovation. So, congratulations for all the hard work, I'm sure. It's probably been a journey.
Thank you so much. And yours is a really good innovation. I think, especially going back 200 years, which is really crazy for me to think that they haven't created something sooner than that.
Yeah.
Um,
But that literally is the perfect close to your point and why PROBr needs to exist. It's like if there's no motivation to study it and you're having all these auxiliary problems like latching issues for the mom, babies choking or getting colic, and at the top is a CEO that's a male that has no idea
uh,
about the breastfeeding,
yes,
the breastfeeding journey. Like someone had to care enough to
that's
study
it.
it, and your platform makes it possible, I think, to continue making these data-driven insights transparent. So I will absolutely follow up and see how we can accelerate our phase 2 and get this in the hands of more new moms. Is there anything that we haven't hit on before we close that you just want to share with the natural nipple community?
Yeah. I guess really it's kind of just letting your audience and my audience know that definitely be more in tune and just be prideful over yourself and just take on new tasks. So if there are new ways to help improve society and healthcare, to be more specific,
Mhm.
do take it on. Obviously, Asking questions is the best way to start. I think asking questions is the best way to go in and have more education.
Yeah.
And I think a lot of people, especially those who don't have resources, do not ask enough questions.
Yeah.
And I think we need to
Yes.
think of ourselves as a 3-year-old who asks why all the time. And I think that would be the best way for us to kind of, become a lot better and advocates for ourselves.
That's so simple, but also attainable. I
Mhm.
think that's such beautiful feedback. I think a lot of trust is placed in a healthcare system that has a lot of artifacts and has a lot of processes that do
Mhm.
need to be reinvented and changed. And unless we're the ones being curious, like, I'll just close and in transparency, what drove my desire to make an impact in health and human health in underserved communities was we grew up on Medicaid, and I remember the feeling of going into these clinics that are
Mhm.
designed for poor people. And the way my mom was treated when I was 9, I was just, like, this is less than human.
So,
Like, feel this
yeah.
doesn't feel good, and it doesn't encourage her curiosity about her health either. And so she as an adult really has this mentality that doctor knows best. There's
Mhm.
this magic cloud of data that's being transmitted. Like, they've known between all of the
But they
specialists what's gone
were in
on.
so long, so they can't make a mistake. There's
Yes,
just
yes, and outsourcing that trust and that curiosity, that I think, like, that was just the best advice, to come back to yourself and really not be fearful to ask the questions and to take ownership of your body, because it's yours, it's no one else's.
yeah, exactly.